Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. In today's new episode, I will be talking about insomnia. Insomnia is a very common sleep disorder. It affects millions of people. But before I go on, I hope you're all doing well and you're staying safe. So insomnia means that you either have trouble falling asleep or you have trouble staying asleep, or you can have both. So you can have trouble staying asleep, falling asleep, or you can have both. When you do have insomnia, it affects a lot of things. It affects your physical health, it can affect your mental health, it affects your productivity, it affects everything. So there are different types of insomnia. All right, we do have one that can just come for a very short period of time and then go. And these are this type of insomnia is based on stress levels. Like if you're stressed at a particular point in your life, you can experience insomnia. If you have some family issues going on, if you have some personal problems going on, relationship problems going on, if you suffered like a death in the family, if you have traumatic events going on, you may have short-term insomnia, meaning at that time of the event you have trouble falling asleep or staying asleep, or both. So it's short term, meaning that it doesn't last long. It comes and it stays around for during that time that you're having all these problems, and it goes away. All right, so it usually lasts some days or weeks depending on what the situation is. And then we have ongoing insomnia. So ongoing is more of like a chronic problem. So some people have chronic insomnia. No matter what they do, no matter what's going on, they just have problems sleeping, they have trouble falling asleep, they have trouble staying asleep, or they can even have both, as I mentioned before. So it's very common, as I mentioned, and chronic means long term, right? Ongoing. It could last for months, it could last for years. It's just ongoing, and it's sometimes people suffer from chronic insomnia based on another underlying medical problem. All right, so most times chronic insomnia, they have an underlying problem. That's why people have chronic insomnia. So, most times when those underlying problems are treated or addressed, then the insomnia goes away. All right. So most people, they have chronic insomnia because of the types of medications they're taking, or either the lifestyle. Depending on the type of lifestyle they're living. Some people drink lots of alcohol. Some people drink coffee a lot, caffeine. Some people use tobacco. Those things can be the cause of their chronic insomnia. All right, so as I mentioned before, some people take medications that can actually cause insomnia. All right, and then some people have certain medical conditions, as I mentioned before, and that's what is causing their chronic insomnia. And as I said, once all these problems are addressed, the insomnia tends to resolve. All right, and then some people, they just have chronic insomnia. It's not based on anything else. It's not based on an underlying condition. It's just a primary problem. There's nothing causing it, and it's very hard to understand why they have this problem, but it's not related to pretty much, or you can't tie it to anything else, so some people do have chronic insomnia that is not caused by something else. All right, so let us talk about the risk for insomnia. Yes, we do have risk for insomnia. All right, so actually, research has shown that insomnia affects women more than it does men. So yes, women are more affected, and it can be at any age actually, but I've seen a lot of older people get insomnia more. All right, as I said before, I work mostly with geriatric patients, and I see this in about 90% of my patient population. All right, so they do suffer from insomnia. So the risk for insomnia include inactive lifestyle, as I mentioned, lifestyle. Some people have lots of stress. They're just that's just the way they are. They have loads of stress, and some people they have other mental health problems going on with them. Some of them have depression, some of them have anxiety, some of them, they have family problems going on, and those increases their risk for insomnia. All right, so as I mentioned before, if you suffer the death in your family, if you're going through divorce, emotional stress, some people is their lifestyle, how they live, some people are out of work, and they are thinking a lot, they're depressed, some people it's their work. Some people, because of the type of work they do, it increases their risk for insomnia. So some people alternate shift, so meaning that some people work day shift, they switch to night shift, they switch back to day shift, and that just messes up their rhythm, and that may be the cause of their insomnia. All right, so yeah, and actually too, research shows that African Americans take longer to sleep. I did not know that. Yeah, until I did the research. So research shows that African Americans take longer to fall asleep, and that they don't sleep as well, all right, than whites, all right, than white people. Okay, so let us talk about the symptoms of insomnia. All right, let's talk about the symptoms of insomnia. When you have insomnia, as I mentioned before, you may be waking up too early. All right, you may be laying awake or lying awake for long periods of time before you fall asleep. So you have trouble falling asleep. All right, and then you have trouble staying asleep. All right, you may get to sleep, but then you cannot sleep all through. You have to wake up, and being awake for much of the night. Yeah, you wake up, you can't go back to sleep. All right, sleeping for only short periods. As I said, some people they can go to sleep, but then they can't stay asleep. They have to wake up. They only sleep for like short periods of time, and they have to wake up every 2 hours or something like that. All right, and they have problems going back to bed. And then some people cannot even fall asleep easily. All right. So those are the symptoms of insomnia. And as I mentioned before, it could be caused by other medical problems, and it could be by itself. And it just needs to be addressed. It needs to be addressed. All right. So when also you have insomnia, it tends to affect your productivity, as I mentioned earlier. Yes, it does tend to affect your productivity. You get to have daytime sleepiness. Daytime sleepiness is very bad, especially when you work. All right, you have, lack of energy. You're always tired. You're always fatigued, and you're just like you think that you're just useless during the day because you're always falling asleep. It can cause daytime dizziness. It can make you more depressed. It can make you more irritable. It can make you more anxious because you're not getting enough sleep. It just makes life miserable for some people. Some people just snap at other people easily because they lack sleep and they can't sleep. They're more irritable, as I mentioned before. All right, so some people, it affects their relationships as well, right? If they have insomnia, it affects their relationships. They can't, when people are hanging out saying, they have friends or loved ones that want to hang out with them during the day. Let's go out, let's go have fun, let's go out. They were like, I'm tired, I don't want to go anywhere, just leave me alone. I'm exhausted, I want to sleep, I didn't sleep all night, and it affects their relationships that way. All right, and then some people, because of the lack of sleep at night, they are not as productive as they should be, especially when they work, when at work, and that is a huge problem. They cannot focus at work. All right, they cannot pay attention. Their attention is short. They have short attention span. So, and then some people even affects their memory because they lack sleep, they can't remember a lot of things, they forget things easily, and that's a huge problem. All right, so as I said before, insomnia can cause other problems. Insomnia can cause other serious problems, and that's why it's advised that you should please follow up with your primary care provider if you have problems with insomnia. And definitely you do not want to, when you are very tired and exhausted during the day because of lack of sleep at night, you do not want to be driving in that kind of mood, because then you may end up falling asleep while you're driving and get into a motor vehicle accident, and you don't want that. So yeah, you may feel drowsy, you may feel very tired, and then you may end up getting into a car accident, and you don't want that. So how do you talk to your doctor? How do you talk to your primary care doctor? Yes, you have to tell the doctor what you're going through, because this happens at night, right? So the doctor is not there. Your primary care provider is not there at night to see what you're going through. Just like any other medical problem, you go to your doctor maybe once a year, twice a year, or probably every few months. But then if you do not open your mouth to tell the doctor what you're going through, the doctor is not a mind reader. We can't read your minds. We can't read your minds to know what you're going through. So you have to be able to open up and let the doctor or your healthcare provider, which can also be a nurse practitioner or physician assistant, your primary care provider, whoever that may be, to help you. If you have to open up, let them know that you're suffering from insomnia. Let them know what you're going through. Let them know if you have any mental health problems. Let them know if you're going through bouts of depression, anxiety, insomnia, things like that. Let them know so that they will be able to help you. So pretty much if you open up and they know that you have this problem, they will take your medical history. All right, they will take your medical history. They will ask about your sleep history as well. All right, you tell them exactly how you sleep, when you wake up, what happens. Do you have problems falling asleep or staying asleep, or do you have both problems? All right, and then your primary care provider might be able to do a physical examination, PE, and also check to see if you have any medical problems, underlying medical problems that may be causing your insomnia. And then if they feel that you need some certain test done or diagnostic test done, it will be done. And actually, I forgot to mention, some people have problems sleeping because they may have sleep apnea. So they may recommend you to do a sleep study. All right, so sleep study is pretty much a test that measures how well you sleep and how your body responds to sleep. So yes, they may recommend you to get a sleep study, and that way they'll be able to see if you have any problem sleeping, such as sleep apnea. All right. And also regarding treatment for insomnia, it depends. It just depends on the situation. Remember, I said that some insomnias, they are due to underlying medical problems, other underlying medical problems. So once they do all the tests, once you do your get your medical history, your sleep history, do some certain tests if needed, diagnostic tests to do the physical examination, make sure that there's nothing, or to rule out any medical conditions that might be causing your insomnia. Once all that are done, then we will be able to come up with a diagnosis and be able to know what your treatment would be. Of course, we know that the diagnosis is insomnia, but they will be able to know if there's any underlying issues that need to be addressed. All right, they will know if there's supposed to be something done. All right, and then the treatment will be based upon that. All right, so treatments for insomnia could range from lifestyle changes. Remember, I was talking about alcohol use, tobacco use, lifestyle. Could affect your sleep. Your sleep patterns too. So please make sure that you review all of this with your healthcare provider when you do go in to talk about your insomnia. And so your treatment plan may include counseling if you have mental health problems, stress and anxiety, depression. It could include medications as well. I've seen a lot of older patients be put on medication like trazodone, melatonin, and some is just lifestyle changes, maybe don't drink alcohol or reduce your alcohol intake. Try not to drink caffeine as much as you do, or probably just limit caffeine intake, and stop tobacco use as well. And then just some people, relaxation, music, therapeutic music helps them. Some people, meditation helps them. Some people, yoga helps them. Some people, a lot of other things, alternative therapies can help also for insomnia. Yoga, as I mentioned, meditation, listening to music. Some people, drinking just warm milk might do the trick. Drinking warm milk at night instead of drinking alcohol might help them. And then, as I said, some people, they have to be put on medication. So it all varies. It varies depending on what is causing your insomnia and what the plan will be. So yes, so short-term insomnia is the one that happens when you're experiencing a lifetime life event, so that's short term. So it might be relieved by some little tweaking of things here and there, and just getting counseling for any kind of problems that you're going through. Try to incorporate better sleep habits, all right? And then for the long term, the ongoing insomnia, the chronic insomnia, treating any underlying medical conditions that you may have may help. And then incorporating other things like counseling, which called cognitive behavioral therapy, CBT, cognitive behavioral therapy. Also, if you do have anxiety, it may help. This type of counseling may help as well. And then medications, there's several medications, I just mentioned two. Melatonin you can get over the counter. You do not need a prescription for melatonin, but for trazodone you do need prescription for that one. All right, and then so there are different medications out there that you can use as well. So yeah, it varies. So treatment could range from counseling, medications, lifestyle changes, and a whole lot more. So I hope that this helps, and I hope that you will be able to let your healthcare provider know what you're going through if you're suffering from insomnia. So please watch yourself while you're sleeping, or if you're experiencing trouble falling asleep, staying asleep, or both problems. If you're being if you're getting very tired in the mornings, you feel like you've not had enough rest at night, if you're irritable and you're not productive, and you have daytime sleepiness, you may want to discuss all this with your primary care provider as well. All right, thank you so much. Please share the episode with friends and family, and I will catch you in the next one. Take care of yourself. Bye bye.